I want to talk to you about starting a practice in Florida. One of the first things you got to do is you have to get right with licensure. That's going to take time. If there's any problem in your background, you got some law enforcement interaction, any problem in a hospital that you're on staff, you're going to have to get some help, because the most important thing in Florida on licensure is transparency. You're going to have to be fully disclosed. You're going to need to get help if you have any black marks in your background. It's going to take some time, so you have to plan it. If you have an opportunity in Florida, what you don't want to do is rush to Florida, sign a contract, and think everything's going to be okay. Don't approach it that way. Take time. That's the first thing. Second thing that you're going to want to do is figure out, do you need any kind of odd state licensure? If you're not a physician and you're going to start a practice in Florida, you're going to need a state license. We call it a healthcare clinic license, or an HCCL. It takes time to get one. You can't just walk into Florida if you're not a physician, buy or start a practice without proper licensure. Okay? And depending on the state that you're going to, you're going to encounter odd state laws. It's going to take a little bit of time, and you need to get some research done. The other thing is, in terms of planning, the two things that you're going to find the biggest obstacles are, number one, licensure. We talked about that. The other thing is, and this takes longer, managed care organizations. If your business model includes you participating in managed care plans, guess how long it can take in Florida to get on plans? 12 to 18 months. It can take that long. So make sure that you have the right team put together to get you on these plans. Make sure that you've handled licensure. You've allowed time enough to get into the business in Florida and get active. Next thing is, you're going to decide, do I buy a practice or do I grow one? If you have the financial resources to buy one, you're going to look at buying the stock or the assets. Buying the stock is going to be the quickest way to get into business, because those practices typically have managed care organization agreements. They have what we call participating provider agreements. They're on the plans. You've probably heard that term. So you want to get into practice quicker with a business that has managed care organization agreements, fine. Look at buying the stock. But when you buy the stock, you also get their liabilities. You have to have proper counsel, legal counsel. You're going to have proper tax counsel as well. If you're going to buy the stock, you have to know that there's substantial liability, and buyer's counsel prepares those agreements. Why? Because there's substantial risk and liability associated with it. You're going to want to make sure that you're protected when you buy it. If you're not going to buy stock, you don't have as much exposure, you might buy the assets. Finally, you're going to need help with transition with the selling physician. Patient retention is always an issue. I always tell buyers, look, expect to lose half of the patients. That's going to affect the purchase price. It's also going to affect your transition plan. You're going to want help from the seller. And finally, with respect to the seller being a threat, non-competes are enforceable in Florida. They aren't in every state. Illinois, for example, they're not effective. You can't have a non-compete. Florida, they are. So getting the right non-compete for the selling physician is going to help you protect the business you just bought. Finally, recap, plan it, get the right team in place, and get it done. Thanks.